what you can carry to hospital when you're undergoing chemotherapy treatment to make your life a little easier and more comfy. Chemotherapy itself is something that can stress your mind, that takes so many hours while you're seated and medicine is being administered to your body. So below are a few things you can carry with yourself whenever you're going for a session to help your time pass by. I would spend 1, 2, 3 nights at a time whenever I came, depending on the condition that I was in. But there are those people that can come just for a day, have their medicine and go. So what I'm going to share is just mixed up. Some of it can be relatable to someone that is spending the whole day and night, and another will just spend hours and leave. The number one thing that you should put in your chemo bag is your favorite book to read. Any book that lifts your spirits, any book like the Bible, something that has positive vibes, or books on cancer, of how people have fought cancer and giving tips on how they have done their journey well. A notebook, if your hand is free, that they're not using the hand you use for writing to administer the medicine, you can get yourself a notebook and a pen so that you can write down a few things for your future reference. You can carry around a good attitude. The biggest thing is having a positive attitude, a pleasant attitude, a patient, calm attitude with the whole situation. Do not agitate yourself, think too much, want to, piss people off. Just be calm, be easy with yourself, be easy with everyone, and just let things be. Carry yourself some painkillers if you know what works for you. Normally they'll give you many different types of painkillers, but especially morphine. Morphine is a good painkiller, but it has its downs. It has its side effects with different people, one of it being constipation. Because you're using it over time, it can bring very bad constipation. So study yourself and see what painkiller works for you. And if at all it's morphine, you still have other medicines you can have to counteract that effect. So put those things first in your chemo bag. I used to crave a lot at that time. Like by the time I'm coming for chemo, my appetite levels would be high up. So I would, at one particular point, I think, be craving meaty stuff, burgers, junk, basically fried stuff. So it's okay. Your body needs that. You go get what you want, eat it, and even as you're having chemotherapy and you're able to feed, you can have it concurrently. Because I remember I used to eat myself saline, then I would be, on the drip, because they would give you drip for full 12 hours. They move this drug, they put another one, takes 3 hours, another take. You would be vomiting depending on the effects you're having. You could be diureting while they're doing that. So if you're someone that is in my condition, I don't know how others were or how they be, but for my case, I kept needing to go to the toilet. I kept needing to puke. So carry along a small bucket that you can, do that in, and then have yourself a carer, someone that you trust. I'm not saying you will choose, but pray to have a good carer that comes with you, that is able to go through those inconveniences of having to move you, take you to the toilet and bring you back, or having to clean up whatever mess you've done. That's not something you pack in the bag. It's just something of the mind, like to prepare even the carers for what they're going to go through. Just have it in mind that you have to help someone that way. Pack a drink, pack water or tablets, any that you're having, maybe anti-vomit or whatever that you have. Then have clothes, appropriate clothing. If it's a cold time, carry yourself some sweaters, some socks. If it's hot, you can carry around light clothing. You can carry an extra cloth if you're a day person, because you never know what will happen. But if you're going to stay overnight, definitely pack things that are enough for you to change into. Carry some earphones if you have a phone. and you have data and you're able to afford it, get data so that you can make yourself busy and distracted by listening to positive sermons, listening to positive talks, jokey stuff to make you laugh. You can also carry yourself a comfy pillow just to, recline to when you feel like you need to sleep. But above all, give yourself a peace of mind. This is just a phase that eventually goes, just like any other thing. Do not stress about it. Do not fear. Do not panic. People have gone through it and come out. You too can do that and come out.